Normal obstetric ultrasound findings. Legal disclaimer. Information is for general and educational purposes only. Content is not nor intended to be a substitute for professional legal or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained and expressly disclaims liability for errors and omissions. The course objectives are by the end of this course or session, participants will be able to verbalize how obstetric ultrasound helps in identifying pregnancy-related pathologies. Participants will be able to verbalize the normal obstetrics findings during the first to third trimester. Participants will be able to verbalize fetal anatomy in the second trimester, and participants will be able to verbalize the placental position. This topic is important because it helps identify several pregnancy-related pathologies. It is the preferred imaging modality for diagnosis and monitoring of pregnant women and their unborn babies. It allows doctors to see inside the uterus and provides much information about the pregnancy, such as establishing the presence of a living embryo or fetus, estimating the age of the pregnancy, diagnosing congenital abnormalities of the fetus, evaluating the position of the fetus and placenta, determining if there are multiple pregnancies, and assessing fetal growth and well-being. Ultrasound is a convenient, painless procedure that yields immediate results and is considered widely safe. Use of ultrasound during pregnancy is vast and has become the standard of care in the evaluation of pregnant women. Obstetric ultrasound helps in identifying pregnancy-related pathologies by providing valuable insights into the mother's and fetus's health throughout pregnancy. By creating real-time images of the fetus and the surrounding tissues, ultrasound enables healthcare professionals to detect and monitor various conditions, including gestational age assessment, multiple pregnancies, placental location and anomalies, structural defects in the fetus, congenital malformations, and fetal growth and well-being. How does obstetrics ultrasound help in identifying pregnancy-related pathologies? Well, that's a great question, and some of them are listed below, such as uteroplacental blood flow, amniotic fluid volume, presence of polyhydramnios, which is excess amount of amniotic fluid, or oligohydramnios, which is a low amount of amniotic fluid, fetal heart rate and rhythm, evidence of miscarriage or ectopic pregnancy, assessment of maternal cervix and uterine size. They screen for genetic abnormalities, and monitoring of maternal and fetal vital signs. Early identification of these issues can facilitate timely intervention and treatment, thereby reducing morbidity and mortality rates for both mothers and infants. Additionally, ultrasound serves as a crucial component of antenatal care, allowing for informed decision-making regarding pregnancy outcomes and ensuring optimal maternal and fetal health. So during the first trimester of pregnancy, which lasts from the 1st through the 12th week, significant changes occur in the mother's body to support the growth of the placenta in the fetus. Hormone levels change, the uterus begins to support the fetus, and the blood supply increases. Common symptoms include fatigue, tender breasts, mood changes, cravings, headaches, and morning sickness. First trimester, which is week 1 to week 12, it's first noticed when a missed menstrual period is one of the earliest signs of pregnancy. Breast changes, increased breast size and tenderness may occur due to hormonal changes. Nausea and vomiting. Morning sickness is common, but it can happen at any time of the day. Fatigue, which is because of increased levels of progesterone, can lead to fatigue. Frequent urination. Growing uterus puts pressure on the bladder, causing increased urination. Mood swings are caused by hormonal changes that can affect the mood and emotions. Pelvic discomfort. Some women may experience mild pelvic discomfort due to uterine and ligament changes. The second trimester, which is week 13 to week 26, often more comfortable for most pregnant individuals as early pregnancy symptoms diminish. During this time, the baby's movements become noticeable and screening tests like gestational diabetes tests are typically done. By this time, you usually have a visible baby bump, So the abdomen starts to expand as the uterus grows. You'll have reduced nausea in most women. Sometimes morning sickness goes away by the second trimester. Fetal movement, known as quickening or feeling the baby's movements, is commonly experienced. Glowing skin, some women may notice an improvement in skin appearance due to increased blood flow. Breast changes, nipples may darken, and colostrum or early breast milk may be produced. Linea nigra, which is a dark line, may appear on the abdomen due to hormonal changes and increased energy. Fatigue often decreases and energy levels may rise. So the third trimester, week 27 to week 42. In the third trimester, 28th week until birth, healthcare visits become more frequent. Tests for protein in urine and blood pressure checks are common. Travel restrictions may apply during this period, and it's a good time to educate oneself about labor and delivery. Physiological changes during pregnancy include an increase in plasma volume, cardiac output, and heart rate, while blood pressure decreases in the first and second trimesters but returns to non-pregnant levels in the third trimester. Normal findings during a third trimester obstetrics ultrasound, such as verification of the pregnancy, the site and multiplicity if there's more than one, viability confirmation, estimation of fetal weight based on biparietal diameter, femur length and estimated fetal weight, measurements of the head circumference, abdominal circumference, and femur length are also included in the measurements that are typical in the second and third trimesters. Also, some things to note during the second and third trimester, amniotic fluid index and estimation of hydramnios or oligohydramnios normal range is 5 to 25. Take notice of the placental location, thickness, and maturation, typically posterior, presence of fetal structures including the heart, lungs, liver, kidneys, and bones, umbilical cord appearance, insertion and number of vessels, absence of structural abnormalities or signs of distress, documentation of fetal movements, tone, and breathing patterns, confirmation of fetal presentation such as cephalic or breech, and lie, sometimes transverse, longitudinal, or oblique. Weight gain could be continued weight gain as the baby grows. Shortness of breath, growing uterus can put pressure on the diaphragm, causing shortness of breath. Backache and pelvic discomfort, strain on the back and pelvis due to increasing weight. Braxton Hicks contractions, irregular and mild contractions preparing the uterus for labor. Some swelling of the feet and ankles is common. Frequent urination, which is from pressure on the bladder. Nesting instinct, some women may experience an urge to clean and prepare for the baby. And engagement, the baby's head may engage or descend into the pelvis in preparation for birth. Fetal anatomy in the second trimester. During the 20-week ultrasound scan, also known as the anatomy or anomaly scan, it's usually performed between 18 to 22 weeks of pregnancy. Various fetal organs and body parts are examined to ensure proper growth and detect congenital disabilities or structural issues. It's performed and reviewed by physicians. Point-of-care testing scope of practice for advanced practitioners omits anatomy scan. A scan typically includes a detailed look at the baby's bones, heart, brain, spinal cord, face, kidneys, and abdomen. Some specific parts examined include the heart with its normal chambers and valves, the stomach position in the abdomen, and external genitalia for sex determination. So what to expect? The organs that are examined are the bones, the heart, the brain, spinal cord, face, kidneys, and abdomen. They look at the bones to see if there's any abnormalities within the bones, the heart to see if there's any blockages. They look at the outflow and inflow tracts, the brain, looking at all the structures in the brain, such as the ventricles, the cavum septum pellucidum, the spinal cord to show if there's any spinal cord abnormalities, the face looking for any type of cleft lip or cleft palate, anything involving the orbits. Kidneys are looked at to see if there's any blockage or any type of outflow problems, and the abdomen to see if there's any gastroschisis or any problems with the umbilical cord and the insertion point. The purpose for this exam is to check for proper growth and detect congenital disabilities. Sex determination is based on the development of external genitalia. The results, most scans show normal development. However, some health issues may not be detected. For follow-up, if an issue is found or suspected, further tests or consultations may be recommended. The significance of the scan. The 20-week ultrasound plays a crucial role in assessing fetal anatomy and detecting anomalies that can impact perinatal outcomes. It allows for early diagnosis of conditions that may require medical intervention or affect pregnancy management. Additional information. A scan can identify various abnormalities such as heart defects, cleft lip, diaphragmatic hernia, and skeletal dysplasia. Skeletal dysplasia is referring to any type of growth restrictions, dwarfism, things of that nature. It's essential for evaluating fetal growth and ensuring the well-being of both the baby and the mother during pregnancy. The examination of the fetal anatomy through ultrasound aids in early detection of potential health issues and guides appropriate medical interventions if needed. By providing detailed insights into fetal development and health status, the 20-week ultrasound scan is a vital component of prenatal care that helps ensure the well-being of both the mother and the baby. Placental position. This is a very important one to make note of. Position of the placenta can be determined by an ultrasound, usually at the 12-week and 20-week scans. The placenta can be situated anywhere on the surface of the uterus, including the front wall, which is anterior, the back wall, which is posterior, the side walls, left or right lateral, or top wall, which would be fundal. Location of the placenta is important due to that it can be checked during ultrasound to avoid serious complications such as a low-lying placenta or placenta previa. And that can be avoided completely by proper placental positioning and identifying where the placenta is located. If the placenta is too low in the uterus, it can cause bleeding and prevent the descent of the fetal head during labor. Generally speaking, if the placenta is more than 2 centimeters from the cervix at the 18 to 20 week scan, it won't be low-lying at the time of birth and doesn't need to be rechecked. However, if the placenta is less than 2 centimeters from the opening of the uterus into the cervix, which is called the internal os, at the 18 to 20 week scan, it may still be low-lying at the time of birth. About 10 to 15% of placentas are low-lying at the 18 to 20 week scan, but only about 0.5% are still low-lying by full term. If the placenta remains low-lying after the 32-week scan, serial ultrasound will be performed and close monitoring during labor. So, in conclusion, obstetric ultrasound is a useful technique for identifying several pregnancy-related pathologies. During the first trimester, ultrasound can confirm a viable intrauterine pregnancy and diagnose conditions such as ectopic pregnancy, abortion, and gestational trophoblastic disease. In the second trimester, ultrasound can be used to evaluate fetal anatomy, fetal biometry, amniotic fluid volume, placenta, maternal cervix, and Doppler velocimetry of uterine and umbilical arteries. In the third trimester, ultrasound can assist in the evaluation of fetal cardiac rate and rhythm, amniotic fluid volume, placental location, exclusion of previa, delineating possible fetal injury, and confirming fetal demise. Ultrasound can also be used to diagnose or monitor maternal anatomical problems, such as cervical length in the setting of risk factors for preterm birth or cervical insufficiency. Overall risk of complications with ultrasound is low, but a transvaginal ultrasound may cause complications such as anxiety, pain, or vaginal bleeding.